In this video, we're going to talk about how to prevent herniated or bulged discs by strengthening your spine. We'll show you exactly what happens when disc injuries occur, and then give you some tips about how to prevent them. In the last part of the video, we'll show you some very effective exercises so you can strengthen the muscles of your spine and really combat this problem. At the end, I'll show you one more really super simple exercise that will make a great difference and you can feel it working right away.
Hi, I'm Dr. Bo.
I'm Dr. Dan.
And we are Two Fit Doctors.
I'm Dr. Dan from Two Fit Doctors. Our channel is devoted to helping people train, grow, and thrive at any age. But that's very difficult if you're suffering from back pain or leg pain from a bad disc.
I agree. I'm Dr. Bo from Two Fit Doctors. On our channel, we talk a lot about exercising and about actively regaining your health. But we also like to address some of the problems that some people encounter that keep them from doing the things that they want to do. And in my experience, one of those problems is definitely disc injuries. And unfortunately, they don't get better on their own typically. In fact, they tend to deteriorate in time if left unattended. As chiropractors, we have together over 60 years of clinical experience in a technique called Gonstead. This technique was very disc-oriented, and I can say during that period, we lost very few patients to surgery. So we feel we have a very unique take on treating these injuries from a conservative basis.
It's true, Bo, and I like the word conservative. Conservative meaning non-surgical. Unfortunately, sometimes the line between conservative approach and spinal surgery is gray and difficult to ascertain. So sometimes a patient getting better can depend on who the patient goes to see first.
I have several friends that are very responsible surgeons, and unless you happen to have an extremely serious injury, most of them are going to tell you, do everything you can first before resorting to surgery. However, there are always those that may be aggressive and may want to opt to surgery first. We want to do everything we can to keep you from having an unnecessary surgery.
Fortunately, if it's done correctly, chiropractic care can only help you. It will not make your condition worse. If the chiropractic care doesn't work, you're always free to try more aggressive options. Then you can look at surgery if you want to.
Just a word on this as well. There are many techniques under the broad banner of chiropractic. The technique that Dr. Dan and I are most versed with is the Gonstead system of chiropractic. Dr. Gonstead was a mechanical engineer prior to going to chiropractic school, and he applied his understanding of mechanics to the spine. So because of this, his results were extremely good with very, very critical cases. So if you're somebody that's suffering from a disc injury, or you're just looking for somebody that might do something different than what you're experiencing now and might give you some hope, we've included for you in the description below a link to the International Gonstead Directory to see if there's a doctor in your area that might be able to help you. Well, let me show you why chiropractic is so effective at treating disc injuries. In order to do so, though, we're going to have to take a look at the mechanism of injury that exists when a disc herniation or disc injury does occur. So if we're talking about disc injuries, we have to talk about the anatomy of the spine. The spine itself is composed of 24 individual bones, each one of them we call vertebrae. In the lumbar spine, there are 5 vertebrae. In the thoracic spine, there are 12 vertebrae. In the cervical spine, there are 7 vertebrae. Now, coming out from between every pair of these vertebrae, we have a spinal disc. The disc itself also has 2 components. It has annular fibers, ring fibers, that are very much like the layers of a tree that we see when we cut through a tree. But in the middle, we have what is called as the nucleus. The nucleus pulposus is a raised almost fluid ball bearing by which the rest of your body pivots on. The annular fibers of the disc help to keep that nucleus in the center. The spine also has 2 types of curves when we look at it from the side. You have lordotic curves and you have kyphotic curves. When the nucleus in the disc shifts, the vertebrae itself also misaligns. This traumatic event is what causes much of the injury that you experience and much of the inflammation. The goal of the chiropractor should be to reposition the vertebra in such a way that we're also allowing the nucleus to shift back into its normal place. Your inflammation comes down, and now you're in the best situation you can be in to allow healing to truly occur at that joint level. This is the reason all back classes teach you to lift with your legs and not with your back.
Great advice. Let's talk a little bit more about how to do that. Here are a couple tips for preventing lower back disc injuries. Tip number 1, handle any existing spinal disc problems first. If you have regular aches and pains other than the soreness from working out in the gym, I'd highly advise you get evaluated by a chiropractor, preferably someone who examines you objectively on each visit rather than giving you the same generic treatment every visit. If it's from a chiropractic or mechanical or disc issue, these problems will not get better on their own. You're not going to be able to exercise it better. In fact, it can be dangerous to exercise with the pinched nerve. Not only do they cause pain, but they also cause weakness and further imbalances that can lead to more serious injury. Tip number 2, build a super strong arch in the gym. You can also prevent spinal disc problems from strengthening the musculature of your lumbar arch. If you want to protect your spine from flexing forward, develop the musculature so you have an iron posterior arch. In the gym, prioritize your arch with all your exercises from here on out. Always arch, never round your back. When you lose your arch, it's usually the first sign of technique breakdown. Number 2, reverse hypers, back raises, and good mornings. Work these exercises into your routine as often as you can. Do thousands of reps here. Number 3, posterior chain exercises. Use these posterior chain priority exercises as often as you can. Deadlifts, deadlifts with chain or bands, squat, safety squat bar squat, safety squat bar squat with bands, safety squat bar good morning, safety squat bar good morning with bands. Number 4, train your core correctly. Stop doing endless crunches and wasting time on machines. Use exercises to train your core with straight legs, so straight leg exercises work really good. Also, emphasize your obliques with a 60 to 70% priority.
So to sum this all up, we lift with our legs so that we limit the amount of forward flexion we do of our lumbar spine. This also helps us to redistribute the weight away from the discs and more towards the larger muscle groups. Earlier, we showed you how the curves of the spine are formed and therefore give you more protection in extension than in flexion. Knowing this, we also know that there are certain positions that you get in that will make you more vulnerable to injuries than others. We also talked about why disc injuries occur and what actually happens inside the disc and why chiropractors are very capable at helping you get better when you do have these types of injuries. The anatomy also supports the idea of how you would strengthen it. If you can strengthen your lumbar arch, it will take more weight to flex it forward and put you into the danger range. You will also have better muscular tone while at rest. We have talked about some of the most effective exercises to build your arch. Now, I know some of the exercises we showed earlier are difficult to perform, but they're just like any others. When you start doing them, the more frequently you do them, the better you're going to get at being able to perform them. Like any other exercises, you just start with the bar, get used to the motion, and then add weight over time.
At the start of the video, I mentioned some additional content we want to talk about. It's a great way to get started. Start using the back raise every single time you warm up. Regardless of whether you're doing upper body that day or lower body, warm up using the back raise. Do so with 3 to 4 sets of 15 to 25 reps. Not only does this get your lumbar arch nice and warmed up, it also sneaks in thousands of reps to strengthen the lumbar musculature and ligaments.
If you like this video, we'd greatly appreciate a thumbs up. And if you'd like to know how you can train, grow, and thrive at any age, subscribe to our channel. If you want to reach out to us on anything that was discussed, you can always address that through comments below, or you can email us directly at info@twofitdoctors.com. Thanks.